right, I'm going to give it a minute to let people stroll in, and then I'll start. All right, let's get started. Today's session is brought to you by Advanced eClinic Training, who provides online healthcare training and medical certification programs. And we're honored to have Dr. Andrew Reed Fuller, who is a clinical assistant professor and director of resident training in oral and maxillofacial surgery at Texas A&M School of Dentistry. He holds both an MD as well as a Doctor of Dentistry surgery degree. As a resident, Dr. Reed Fuller was the president of the resident organization of the American Association of OMS. He went on to hold numerous leadership and in leadership positions in national and international organizations, such as OMS Foundation Board of Directors. Please welcome Dr. Reed Fuller to this. All right. I think you're on mute, Dr. Reed Fuller.
Sorry about that. All right. We'll try that again. Okay. So thank you again to everyone who's here on the presentation, and thanks to the event organizers. Just kind of looking through your program for this conference. It's a great program, and all I can say is I wish something like this existed when I was going through the process and trying to decide on a career and learn more about where I wanted to go, because I think there are always a lot of things to learn, and it's always helpful to get involved in groups like this to learn as much and make as educated of a decision as you possibly can. So just quickly, I have no financial disclosures, no conflicts of interest. And really sort of the overall concept of this presentation, and I have a feeling that given the audience, there's probably a lot of people who are in this position where you're really thinking about two different possible career paths, whether that's dentistry, medicine, or any of the other healthcare specialties that are out there. And I can definitely relate to anyone who is trying to learn about it, make some educated decisions, consider different pathways, and I certainly appreciate what a big decision it is. So I think it's something worth discussing and bringing up the pros and cons of either path. So really my objectives are to go through some of the similarities and some of the differences between both medical and dental education in terms of the actual educational path, but then also what the differences and similarities might be in terms of a career. Basically, once you're done with your training and your education and you're out in practices, what are the pluses and minuses? What are some of the differences between the two? And then lastly, as I guess the somewhat shameless plug of the presentation, I'm also going to talk about my specialty of oral and maxillofacial surgery and why I think it's the best specialty in the world. So obviously I'm biased there, but hopefully everyone out there will ultimately love what they do, as certainly I do. I know it's just mentioned, but I'm a program director of oral and maxillofacial surgery at Texas A&M. which basically means that I'm in charge of all the educational programs for our oral and maxillofacial surgery residents. So I teach primarily at the resident level, but I also teach a good amount, particularly didactic lectures for the dental students. So I have a pretty good sense, at least, of the span of people who are either at the beginning of their educational process all the way to the end, and seeing how, you know, the different questions and concerns and thoughts that people have when making a career choice. And I also, as part of that, counsel dental students and medical students if they're trying to decide what they want to do in terms of what they want to specialize in or what career path they want to take. So I certainly understand where a lot of those questions and thoughts come into play. I'm a dentist and a physician. I went to UCLA for dental school and then UT Southwestern for medical school. But I was a politics major in college. So I don't know if anyone else here is in the same boat, but I was definitely not a biomedical person as an undergrad. And I kind of came into medicine and dentistry through a little bit of a circuitous route. So if you're in that position, that's absolutely fine. You'll manage to survive school regardless of sort of your background in education. Just quickly in terms of, you know, the beginning part, kind of more where you might be at this point, you know, what are the differences? I know this is a very, you know, educated audience and probably have already done a lot of research on some of these things, but looking at the application requirements, they're very similar. So it's a lot of the same undergrad classes that you need to take. The main difference is the entrance exam, the MCAT versus the DAT. So there are some differences for sure in terms of that exam format, but everything else sort of leading up to that is basically the same. Of course, different schools may have slightly different variations in their requirements, but in terms of the core types of basic science classes you need to take, it's very similar. School length is the same and generally structured the same. And without getting into too much detail, both in dental and medical school, certainly there's been some shifts in terms of how the classes are structured and the time is structured. But in general, it still holds relatively true that the first 2 years of either dental or medical school are primarily preclinical, and the last 2 years are more clinically based. Big difference is that in medicine, residency is basically required, and in dentistry, it's not required. I have an asterisk there because there are a couple of states where you're actually are now required to do 1 year of postgraduate training, but nationwide overall, that's not required. You can see some of the differences in residency length. In terms of admission, you know, how hard is it to get in? Looking at the statistics, the average GPA you'll notice is slightly lower than in dentistry than in medicine. These are figures to be completely frank, got off the internet. So just doing my research for this presentation, but that's the latest data I could find. And you'll notice the debt is, as I'm sure you're all aware, quite high for both dentistry and medicine, but the average debt is a little bit higher in dentistry than medicine. Probably a few reasons for that, but either way, it's a rather big financial investment. So what's the day-to-day like in dental school? You know, what can you expect once you actually get into dental school? Well, the first big thing is that, you know, for the first 2 years, it's really a combination of didactics, meaning lectures, with preclinical labs. So I'll mention medical school in a second, but one of the major differences is that, you know, you're taking a lot of the same types of introductory courses, your sort of pharmacology type courses, your system-based pathology, gross anatomy, all of those types of topics. But you're also learning things that are kind of specific to dentistry. And part of the way you learn that before you're allowed to touch any patients is to, you basically sit in a lab, big open area like you see in this picture here, where you practice drilling on plastic teeth and doing denture setups and doing other sorts of things that sort of prepare your hand skills to understand exactly what it is you're trying to accomplish once you're actually treating a patient. When you get to the third and fourth year, as I mentioned, it shifts much more towards being strictly clinically based. So you're in clinic most of the time. There are some places where you might rotate for brief periods of time, but overall you're in your core clinic. You can see a picture from our dental school, but it's pretty typical in most dental schools, big open bays, where you got your own dental chair there and you kind of have your own patients and you treat them there. And certainly sprinkled in is some didactics, but mostly clinical. For medical school, first 2 years, very similar to dental school, but of course you're not learning any of the dental specific stuff. So it's a lot more focused very specifically just on the didactics. Your third and fourth year, also very clinically based, just like it is in dental school. Typically your third year, you're going to be doing what are called core clerkships. So that basically means that you're required to rotate with the most common, biggest specialties within medicine, things like surgery, internal medicine, pediatrics, those types of things. And whereas in your fourth year, if say you're interested in orthopedic surgery specifically, or you're interested in cardiology, or you're interested in something that's, not one of the main sort of core specialties, you can spend time with those specific areas that you're interested in applying for. One question I always get, which is harder? And really the answer to that is it's really a difficult question to say, because there are different strengths and weaknesses that people can have that might make you stronger in one type of environment versus another. I will say when it comes to just flat out didactic tests, you're sitting down with the old, Scantron sheets, or maybe you're taking it on a computer. Those tests in medical school are extremely hard. And it's almost difficult to explain why, but you really, really need to know your stuff to do well on those didactic tests in medical school. Dental school, the didactic tests, I would say on average, are a little bit easier in my experience. But the difficult thing is, at the same time you're taking didactic tests, you're also taking some of those preclinical tests. So you might have to, you're staying up late, staying up for some big final. You guys are all very familiar with that idea. You have to take some big pharmacology, maybe cardiovascular system test in the morning, but then an hour later, you might have a practical test on making crown preps or something like that. So you're literally going into the lab and you're having a completely different type of test experience. So you really have to be good at managing and switching gears kind of completely between very different topics when you're taking tests. So it more grinds you down in terms of having to balance your skills and your preparation for different types of tests at the same time. So some are, in other words, depending on your strength, you might fit better with one versus the other. Standardized tests, overall, pretty similar type of process. I will say the same thing is true in the sense of medical school, standardized tests, didactic tests being just unbelievably difficult. I mean, I don't want to scare anyone, but these are some of the hardest tests you're ever going to take in your life. So it takes a lot of preparation to do well. In dental school, you have didactic tests, but again, not enough time to explain it in detail, but you also have to take a clinical test where literally you, now it's shifted more towards being in a lab setting, but it's sort of a one-time high stakes test where in front of outside, supposedly objective observers, you have to do something like, prep and fill a cavity, do a root canal on an extracted tooth, things like that. So it's a lot of pressure, different type of pressure. Patient care, big difference, medical school. They're not really quote unquote your patients. You're basically shadowing, following around a resident or an attending, working with them. But at the end of the day, it's somebody else's patient. In dental school, you kind of have your own core of patients. You're doing basically all of the treatment through those last 2 years of school. Fourth year with medical school, it's a little more of a flexible schedule. I mentioned that you can kind of pick and choose what you want to do. And basically, once you match into your residency, for the most part, you're relaxing. The last 3 or 4 months of medical medical school are generally fairly stress-free, whereas with dental school, you're trying to finish certain clinical requirements. It goes up to the last minute. And overall, I would give the edge to medical school being more challenging in general for getting into residencies. Dental school, still difficult, but there are only a couple of specialties where it's exceptionally competitive, oral maxillofacial surgery being one. Residency, also something to think about. Dental residencies are optional. You basically, the vast majority of people, about 80% of dentists, once they graduate from dental school, go straight into practice. So that's a big difference compared to medicine, where you're required to do a residency. Another important difference, basically all medical residencies, you're paid. Not a lot of money, but it's certainly enough money to live on and be comfortable. Something $50,000, $60,000, $70,000 range set through a formula. Whereas in dental residencies, some residencies, again, oral maxillofacial surgery, hospital-based ones, you'll get a salary, but there are some like orthodontics where you may get a small stipend, or you may actually have to pay a substantial amount of money. Basically, it's almost like 2 or 3 more years of school where you're paying tuition, which again can be the same thing, $40,000, $50,000, $60,000 or even more a year in tuition. You really have to check. Each specialty is a little different and each program's a little different, but that's certainly the financial part is something to factor in. And then the other thing to add on is, yes, the residencies are longer in medicine, but it can get even longer than that, because depending on the type of specialty you want to do, the ultra competitive subspecialties, you may also have to take time off to do research and do a fellowship. So for example, if you want to be a pediatric surgeon, which is extremely competitive, you have to do medical school, 5 years of general surgery residency, generally have to take a couple years to do research, and then do also a 2-year fellowship. So you do the math on that, you're getting well into your 30s, frankly, before you're done, even in the best case scenario. So it's a long path. What's the day-to-day in dentistry? For the most part, you're in an outpatient clinic. The setting is more consistent in dentistry, for sure. In the past, dentistry's really been popular because most dentists own their own practice, and that's still largely true. But there are more what they're called DSOs, dental service organizations, which are basically large, almost chains of dental services that are out there. And so a lot more people are moving into basically an employee model of being a dentist. So you work for a bigger group. Again, probably more consistent hours, but if you own your practice, you have to factor in the time, the extra time after work, before work, weekends, things like that. You're running a business, the buck stops with you. That can bring on some extra work. But certainly people in more mature practices especially may only work 3 or 4 days a week. So that's obviously pretty nice. In medicine, huge variability. And I'm trying to sort of illustrate the pictures here, but you can be anywhere from being in a busy, stressful, high volume, high acuity, emergency room, surgery type of environment where everything is go, go, go. And it's very exciting and stressful, which some people like. Or on the other extreme end, I know of some radiologists, for example, who, thanks to modern technology, can actually work from home. So I don't think we normally think of physicians as working from home, but that's possible in certain instances. So the point being, there's a huge spectrum of kind of work environments that you can be in. But the other trend that does mirror dentistry is that the employee model is sort of the trend, particularly in certain types of practices, particularly types of practices that are pretty much exclusively in a hospital setting. So things like anesthesiologists or emergency medicine physicians work for bigger groups because that's the best way, or at least that's the argument, the best way to sort of create favorable contracts between a physician group and a hospital. So there are some pluses, but also some people will say some minuses to that model. Just sort of wrapping up here in the next couple minutes, but just debunking a couple myths. You know, you always hear dentists are unhappy, you know, they hate their job, they hate where they're working. You know, that's true of any profession, but I don't think there's anything specific about dentistry that makes that true. I know a lot of dentists who are very happy, who have a very good work-life balance, frankly. And that's still to this day, I would say one of the main attractions to dentistry is, you know, if you know, family and having the most predictable schedule is the primary goal, dentistry is tough to beat. On the other hand, the idea that dentists are out playing golf every day and it's just, you know, it's all smelling roses, that's also not true. As I mentioned, you know, if you're a practice owner, for example, there's a lot of stress to working and running a practice. Some may be concerned dentistry is boring. I would argue, you know, there are many different ways to practice, even within dentistry, different specialties, different environments. There are ways to make your job interesting and find the type of practice that's right for you, that you can really enjoy for a long career. Same myth for medicine, all doctors are unhappy. Same sort of thing. You know, we got a lot of type A personalities who go into medicine and dentistry. And so certainly it's easy to get stressed out and have a laser focus on work. But the reality is, especially once you kind of get into practice, depending on the type of specialty and the type of work environment you want to be in, you can really have a lot of control over your schedule potentially. And, you know, certain specialties, I think my emergency medicine room friends probably do it best, you know, in terms of work-life balance. When you clock out, your shift's done, you leave it all behind, and you can go out and enjoy your life. And so that's really nice. You're not taking home your work with you in every single specialty of medicine. And, you know, when it comes to the life and death stresses, same thing. You can go into dermatology or something if you don't want to be in a stressful environment. Some people love that. It's not always for everyone. So quickly, what's oral and maxillofacial surgery? What do I do? It's a specialty of dentistry, actually, but it is possible to go to medical school first. And I know some people who've done that route and gone back to do dental school as well. Going to medical school is optional. It adds 2 years on to your residency. And you may wonder, why does medical school only take oral surgeons 2 extra years? Well, basically, I mentioned those first 2 years of school are kind of overlap. So they basically cut out a lot of those first 2 years and you mostly do the clinical stuff. So got to take all the standardized tests, all the big tests, but they shorten the curriculum. And there's a lot of diversity. You can live a dentistry life or you can live a surgeon life. And that's something that I do in an academic setting. I spend about 2 days a week in clinic doing, you know, more dentistry type stuff. I'm doing third molars, wisdom teeth, dental implants, bone grafting, in a dental school type clinic. And then the other 2 days a week, you're doing big jaw surgery, jaw joint replacements, removing pathology. Some people do cleft lip and palate. So there's a lot of different ways to go. In terms of money, it's always the elephant in the room. You can see the numbers here, but the big thing to say is don't always trust surveys when it comes to salary surveys. I find them largely very inaccurate. So don't read, oh, the average salary of specialty X is this, because very often those surveys are incorrect. Final thing, some parting words of wisdom, really put yourself out there. I think, again, I'm preaching to the choir on this. Go out there, shadow, meet people, go out to lunch with them, ask them questions, see what their day-to-day is like. Do something that makes you happy. So don't go with a specialty or a profession just because you think it's more prestigious. You will be unhappy if you take that route. You've got to do something that you love and you enjoy. If you feel like you're not sure what you want to do, take some time off. I took 2 years off after undergrad before I went to dental school. And that's completely fine. It's a long path. 1 year, 2 years is not a big deal. So don't put pressure on yourself from that point of view. And just remember, though, when you get to the application processes for residency, medical school, dental school, put time and effort into it. because that time, your standardized tests, your interviews, all of that really equal in weight to all the work you've done in undergrad. So you don't, if you think about all the work you put up to that point, you want to equal that when you go through the process. So don't skimp. Don't say, I'm not going to apply to this place because I don't want to pay for another plane flight or something. Go all in on it once you decide to apply, and put your maximum effort in. So I know I went a little over the ideal time, but it's a lot to talk about. So, definitely happy to answer any questions and go back over anything in more detail if I was kind of blazing through some of it.
Perfect. Thank you, Dr. Fuller, for giving such a detailed view. So we do have a couple questions. So to start off, we talked about dental residencies. Could you explain a little bit more of what that entails, especially as someone mentioned that they heard not all dentists are trained on ortho or sleep apnea or need to attend additional courses? Is that what residency is like, or is there something else?
Yeah, so great question. There are fewer dental specialties, and I don't know if I can name every single one off the top of my head, but if you want to be an orthodontist, an endodontist, who's somebody who specializes in doing kind of root canal type surgery, periodontists who basically manage the tissues around the teeth, prosthodontists who do bigger sorts of dental reconstructions. Those all require additional residencies. Most of those are somewhere in the 2 to 3 year range. Now, one big difference between dentistry and medicine is that there's not any specific credentialing when you're in dentistry. So technically, if you're a general dentist, you can take CE courses and learn how to do orthodontics. I think certainly, as a side, some people probably take that a little too far and get in over their head. We see that in surgery. People take some course on extracting wisdom teeth, and then they have all kinds of complications. But it's different than in surgery. I couldn't go to a hospital, for example, and say, hey, I want to start taking out, I want to start doing appendectomies or something, or start delivering babies. They're going to say, well, show me your residency certificate. CE doesn't matter to them. So there's a big difference there, but I think it's both an advantage and a disadvantage in dentistry, because it does give you the chance to expand in certain limited areas and be able to practice that, doing some basic, Invisalign orthodontics or something in your practice. But at the same time, as I said, sometimes people take it too far, and really, if they want to do all these big cases in a specialty area, you're better served by doing a residency instead.
Awesome. Thank you for providing that answer. So you mentioned putting yourself out there really as a word of wisdom. So someone asked, how would we approach a dentist if we're trying to shadow them, just to kind of get an idea of what their day-to-day looks like?
Well, I'll just tell you, and just very quickly to tell you my own story. After my, I think, freshman or sophomore year of college, I went back home, and I didn't really know what I wanted to do. And I basically had an appointment with my dentist for a routine checkup. And, again, in the spirit of putting things out there, he's a guy, as a lot of dentists and physicians can be, very connected to the community. And, I was telling him, hey, I'm looking for a job. Do you have any ideas? And sort of honestly, half joking, said, would you hire me? And he goes, yeah, sure. Come in here. So, work, I'll pay you. I think I was getting $12 an hour or something like that at the time. And I started working in his office, and was my first introduction into dentistry. So I think just going up front, talking to dentists who physicians who asking if you can shadow them. I will tell you, by and large, most dentists and physicians love that kind of stuff. They know it's part of the application process and that it's necessary. And plus, the thing is that you have to keep in mind is most people want to share their careers with other people. They like talking about what they do. They like showing off what they do. So for most dentists and most physicians, it's not a burden. They think it's an honor. It's a great opportunity. They have a chance to kind of show you around and teach you about certain things. So don't have that intimidation factor. Just go out there and ask, and you might be surprised. a lot of people may be very receptive to that. And if you don't know somebody in a specific specialty, let's say you talk to your primary care physician, hey, can I shadow you? And you say, oh, this is really, I like this, but I'd like to learn more about cardiology. Go back to that primary care doctor, say, hey, do you know any cardiologists who you think wouldn't mind if I go see him? And you can kind of build your network from there. I mean, I did the exact same thing. I talked to my dentist. I told him I was interested possibly in doing oral surgery, and he helped set me up to go shadow an oral surgeon. So it's basic kind of networking skills. But again, don't be intimidated by that process. Just put yourself out there. What's the worst case scenario? Somebody says no, right? No harm, no foul. So it's always worth a chance.
Thank you for providing, it's really relieving to hear that most physicians and dentists like to share about themselves. So because you have a degree in both in medicine and in dentistry, someone asked if you like the work-life balance and the business spirit of dentistry, but you also like the content and the emotional connection you feel in medicine. How do you decide which field to pursue?
Yeah, it's very tough. I mean, you kind of have to factor in all the things that you're looking for. So the lifestyles are very different. If your desire, for example, is to have a long-term relationship with patients, right? You want to see them for possibly 10, 15, 20 years. Yeah, you think about on the medicine side, being a primary care physician, going into internal medicine, things like that, or being a general dentist. If you're some very subspecialized person, whether that's, an oral surgeon like myself, or on the medical side, if you're a neurosurgeon or a cardiovascular surgeon, you're going to meet the patient, you're going to get to know them, you're going to do surgery. And once they recover, good chance you're probably not going to see them again. But you have to value what's more of a priority to you and get a sense of what those relationships are like. But the reality is most sort of specialty type care, unless again, you're a cardiologist and, say a pediatric cardiologist and you're working with people with congenital heart conditions, that's a specialist who you may get to know patients over a very long period of time. But a lot of specialties, particularly surgical specialties, it's going to be kind of a one and done thing. So those are the things you just need to figure out about yourself and decide, what matters to you most. What are your priorities? There's no easy answer, I guess.
Great. And with these two fields, there's the different testing with the DAT and the MCAT. So what does the DAT exam look like? Is it very similar to the MCAT?
Some of the content is similar. Some of it's not. I will tell you, it's been a while since I've taken an entrance exam, so I may not be as up on it. You can certainly look any of these tests. They're going to be sample questions online and things you can kind of find and get it sort of a little flavor of what's on the test. I know I saw you had Petros Manassi on yesterday, who, very small world. He was my boss. I worked for Kaplan for about 6 months before starting dental school back in 2007. And he was one of the assistant directors of the Kaplan Center in Berkeley at the time, Berkeley, California. So I worked with him, but that was a great experience, by the way. You learn a lot about how to study for a test, prepare for a test, but those are the kind of things I'm telling you are when I talk about it's worth the investment. Taking those classes, taking a Kaplan class or whatever other kind of class, it may seem like a lot of money. Believe me, that kind of thing is absolutely worth it because those tests are so critical to you getting in to whether it's dental or medical school. Just do it if you're at all on the fence. I mean, everyone knows at this point, hopefully in your life, what works for you best in terms of studying, but get those resources, look it up, get the study books, take the courses. Those kinds of things are 100% worth it.
Awesome. Oh, that's really exciting to hear that you worked with Kaplan before. So in terms of medical specialties, like what medical specialties can allow a little bit better of a work-life balance, kind of like dentists? And is there a chance of like what medical specialties can increase the chances of only working 4 days a week?
Yeah, I mean, you got to look at the kind of specialties where you work primarily in a clinic setting, if that's the thing. If you work in primarily in an outpatient setting, then you're much more likely to have a good work-life balance. Now, I will tell you, even within that, there's a lot of variation. So my wife's actually she's a pediatrician, but she's a hospitalist. She works exclusively in a hospital setting. And the trend has really gone that way. So even for something like pediatrics, internal medicine, used to be that back in the day, you would have a clinic, but then you might admit some of your own patients to the hospital and then go round on those patients in the hospital potentially, and then go back to your clinic. That separation exists in most places in the country now, where you're either in an outpatient setting or an inpatient setting. But in pediatrics, for example, you may have a clinic that's from 8 to 5, but you may be seeing 6 or 8 patients an hour. So there's a different type of stress with that. You'll be seeing a lot of families. The acuity might be a lot lower. So that's really nice. If you're in certain internal medicine, dermatology, there's a reason why dermatology is so competitive. It's because they do well financially, and it's, again, relatively lower acuity. Certain specialties, particularly on the medicine side, where you're primarily outpatient, that's sort of the best way to go. Even some surgical specialties in medicine, I would say you can have that. ENT, for example, do very well financially, but they can have practices that are similar in many ways to say OMS or something like that, where you're doing a lot of smaller procedures, not necessarily of a high intensity level, good reimbursement, working on relatively healthy patients most of the time. Again, there's some ENTs who do head and neck cancer, and that's obviously completely the opposite situation. But there are even some surgical subspecialties where you can really just focus on stuff that's all outpatient procedures, outpatient surgeries, and do well financially and have that work-life balance. But those are the kind of things that you're going to look for. It takes some time, and again, to kind of check out and see if you like the nature of the work too. But those are all important factors in making those decisions.
Thank you for clarifying that question. So when we mentioned about stressful situations, so how do you balance like being under stress and your mental health when you were like in dental school and then when you were in medical school?
I mean, it's very difficult. That's obviously a very hot topic right now. In terms of that, I mean, it's tough because I think, anyone who goes into any of these types of professions, we have certain things in common personality wise, right? We're very driven people, very type A. We expect to do the absolute best on everything that we do all the time. And so it's hard when you feel like you're not reaching up to that expectation. And the reality is, I mean, I don't want to sugarcoat it, but there are some, people who maybe go into medicine and say, hey, I want to go into, plastic surgery or something like that. That's highly competitive. And then maybe they don't do as well. They don't, perform as well, and they don't get into those specialties. I think it's important not to go into medicine or dentistry saying, I only want to go into this field if I get to be this type of specialist, because you're putting way too much pressure on yourself, and it creates a lot of panic if you feel like you're not reaching that level and you may not reach your goal. And to say, well, now I'm going to be unhappy because the only reason I wanted to do it is my dad's also a plastic surgeon or a radiologist or something like that. You hear these stories all the time, by the way. So you really, again, that goes back to one of my sort of bits of advice. You really have to feel like you're going to love the profession and be content knowing you may not go to the exact residency you wanted to go to. You might not get into the exact specialty that you want to go into, but to be happy with, option 2 or option 3. And I think if you have that, that's a way to sort of have that balance or have some of that internal calm. So it's very difficult and it is very stressful. But I think the mentality going in to the whole process is really critical as well. Being realistic. Remember, you go to a competitive medical school, everyone in your class is going to be someone just like you, right? I mean, it's like going to the academic NBA. Let's face it. Everyone in there is going to be a 3.8, 3.9, 4.0 biochem major who has 5 publications and did all this stuff. It's very humbling because you get in that situation and you're no longer always the big fish who's getting, number 1 in your class in every single thing. So that's just kind of part of life. And it's something you need to just sort of mentally prepare yourself for, because myself included, you get humbled by that. You're like, wow, I thought I was smart. And you go to some of these things and take some of these tests and you realize, my goodness, there are some smart people out there. And yeah, they want to go into medicine too, or dentistry too. So it's tough.
Thank you for providing, being realistic. I think it's like a really valuable advice to have. So I think for our last question to wrap up our Q&A, to be mindful of time, is what would you recommend a high schooler who's interested in dentistry to explore or like participate in?
It's tough if you go all the way back to high school. I think the same advice holds, ask if you can shadow somebody, ask if you can go kind of check out their office, ask your own dentist. And if they can't do it, ask if they know a different dentist who will let you do that and shadow them. And, kind of start to get a flavor of the specialty. I think it is difficult because unless you know from minute 1 that when you're going into college that you want to go into dentistry or medicine, it's very difficult, honestly, to get the whole process done and apply and go straight from college to medical or dental school. It's obviously possible, but if you're somebody who's going into college and you don't know for sure for your first year or 2, as I said, that's okay too. That was me. I didn't decide until I was late in college that I wanted to go. And that's why I needed to take a couple years off to take the requirements and do post-bac and all that kind of stuff. But that's completely fine. So again, don't put that pressure on yourself. Don't think when you're 16, 17 years old, you need to know exactly what you're going to do. But at the same time, it certainly doesn't hurt to ask if you can shadow and observe and just learn a little bit more and kind of get the wheels turning and thinking about what it is you might want to do later in life and do in your career.
Awesome. Thank you so much for all the valuable insight. I think that concludes our session for today. Thank you again, Dr. Reed Fuller. It was really amazing to hear about the different fields of dentistry and medicine, because it is like very similar in some aspects, but again, 2 very different specialties, or 2 fields. So nice to have you. And so everyone will transition to our next session on Mayo Clinic application advice.